Welcome back to Fox News at 4. You know, May is Women's Health Month. It's vital for women as caregivers to take care of their health, right? According to doctors, uterine fibroids really common with women, and they say most don't cause symptoms because sometimes of the pain and a list of other problems, it can be kind of difficult to figure out what exactly is going on. But we have a special guest in the studio who knows exactly what's going on, Dr. Rahim from USA Health, joining us to talk more about this. And it can be a sensitive subject for women, and that might also impede whether they get a proper diagnosis.
Yeah, that's very true. I mean, this is a topic that can be very personal to a lot of people. For that reason, I think a lot of women often start the process of trying to figure out what's going on with their OBGYN doctors, where they have a much more comfortable relationship that's already been established, possibly for a very long time.
So we were talking just, off camera here a few minutes ago about the different treatment options, and you say one most women probably aren't aware of.
Right, that's the fibroid embolization, which is where doctors such as myself typically come in. So the three most common options are getting your uterus removed, which is a hysterectomy, a myomectomy, where they just go in and remove the fibroid itself, and then the embolization. The embolization that we do is we use very small catheters. We make a very small incision about the width of a pencil, and we go in through the blood vessels to the fibroid, and we inject different materials to try to block the blood flow to the fibroid. That usually causes the fibroid to shrink to about half its size, and really helps women depending on the type of symptoms that they have. Yeah,
and again, going back to it can be pain, sometimes heavy bleeding.
Absolutely, yes.
But it's great to know that the treatments have progressed, because once upon a time, it was considered a big surgery.
Yes, and it still can be. The advantage of the fibroid embolization is that of the different options, it is by far the least invasive of them, and thankfully they all have low complication rates, but it does also have the least number of complications compared to the other procedures.
I want to go back to talking about the signs. We touched on the pain that can be associated with it, and sometimes heavy bleeding. But what else should women, be looking for if they think that this might be what's bothering them?
So as fibroids grow, the body has to make room for them to grow, so it kind of pushes other structures out of the way. The type of symptoms that they can expect if the fibroids get large enough is it can cause you to have to go to the bathroom more often, you got to pee more often, or you feel like you can't empty your bladder quite enough, and constipation as well. Of course, those are pretty common symptoms to have for a lot of different things, so really talking to your doctor if they think that fibroids may be the cause is probably the best first step to go about it.
And who's affected by this? I mean, is this an age-related problem or not necessarily?
So it is more common as you get older. So about a third of women 35 years old would have fibroids. But once you get to 50, more than half of women will have them. There are certain races that tend to be more affected. Black women in particular seem to have fibroids at an earlier age, fibroids that are more symptomatic, and just more common to have fibroids in general.
Okay. And then also, I was going to ask you, you touched on who's more at risk, but what about your genetics? Does that play a factor in it too?
So if you have first-degree relatives, meaning your mom, your sisters who have fibroids, you are at a higher risk of having fibroids as well.
Okay, all right. Well, a lot of good information here. We thank you for sharing some of it, and we'll be sure to get this interview posted on our YouTube page. That way, if you want to watch it again and share it with someone you know, you'll be able to do so. So look for it shortly on our YouTube channel and subscribe, so that way you know when we upload a video. Thank you, Doctor.
Thank you very much.